So again, thank you everyone who is joining us today for this conversation. My name is Michael Santos, and I direct the Gene Convene Global Collaborative at the Foundation for the National Institutes of Health. Gene Convene supports informed decision-making about genetic biocontrol approaches, and for the last year and a half, we have supported research at the Ifakara Health Institute on perspectives about gene drive approaches to control malaria. I am delighted to be joined today by Dr. Lena Finda, who leads this research, and her colleague, Dr. Frederick Akumo. Over the next 30 minutes or so, they're going to share their insights from this experience. And throughout, please feel free to tweet questions you have for them with the hashtag GeneDriveConversations, and we can work those in as we go along. Great. So again, so excited to get started with you, Lena and Frederick. So Frederick, to begin, before we talk about the research project itself, can you share a little bit about why you're interested in gene drive approaches to control malaria?
Yeah, thanks a lot, Mike. Just first of all, a really quick confirmation on whether you can hear me. I was having a little challenge with the tech in the beginning.
Yes, I can hear you
Excellent.
well.
I mean, it's fantastic that you guys are hosting this Twitter space today. It's great to see all our colleagues and partners online. This is really, really nice, and I hope that we can do many more of this in the future. Gene drives, yeah, this is quite an important technology in my view. But first of all, I just want to remind everybody here that in the year 2000, we had 241 malaria cases for every 1,000 people. Today, that's exactly the same, the number we have, 241 malaria cases per 1,000 people. In other words, even though there has been a lot of progress against the disease, there has not been really much change in terms of the burden. And part of that is just because of population growth. So African population has doubled in the period between 2000 and today. So some of the tools that we have, let's say bed nets, for example, or case management with treatment with artemisinin combination therapies, some of these interventions are very good, but they are giving you, let's say, in some cases, 40, 50% prevalence reduction at any one time. Now, if you put that alongside the population growth, the doubling of population, it doesn't make much change, even though it's actually preventing cases. So what you have is a country that had 10 million people, for example, in the year 2000, if they had 20% malaria prevalence, and let's say they reduce that by 50%, they now have 10% prevalence 20 years later, but the population has gone up, has doubled. So if you're the person dealing with malaria in that country, the total burden is actually still the same. What am I saying here? What I'm saying is that if our intention is to go towards zero malaria, we will need some kinds of intervention that are transformational in nature, some interventions that provide not just 20% or 30% or 40% reduction in prevalence, but something that actually crushes malaria transmission in a bigger way. And there are not many options such as that. At the moment, actually, there is no option. So we've been hoping for vaccines. I still hope that we will have a vaccine. But the other alternative is gene drives. And gene drives have been seen in the laboratory to effectively either reduce malaria population densities, malaria vector densities, to a level that they are almost eliminatable. The other thing that has been seen in the lab is that gene drives can very effectively transform mosquitoes so that they no longer transmit disease. Now, this laboratory evidence is very, very powerful. And for us, if you're having to deal with a disease such as malaria, it's then an ethical question as to whether you should try it or not. So this is why, when you see a technology like that, we say, let's go to the user communities and ask stakeholders there, ask the leaders, ask the community leaders, the researchers, the regulators there. What do they think? Should we be involved or not? What should we do? Should we stay on the sidelines or should we get involved with this? This technology could potentially be beneficial for driving malaria towards zero. So overall, these are the reasons that my colleagues and I at Ifakara Health Institute are interested in this. At this stage, really just talking to people and asking what do they think. and hopefully using this kind of information, channeling it to the developers and the evaluators to get this incorporated in the ongoing development of gene drive technologies. Back to you, Mike.
Yeah, great. Thanks so much, Fredros. And Lena, you've been studying perspectives about gene drives for multiple years, going back to your PhD thesis work. I'd love it if you could share with us why this work is so important.
Yes, Mike, I have been on this for quite a few years now. I didn't start with gene drives. It was with GM mosquitoes, just in general. I think back in late 2016, we had a visit from Professor Frederick Trippett, and he presented to us the ongoing work in genetic modification of mosquitoes for malaria control. And I realized at the time that nearly all of us at Ifakara, the scientists, did not really know much about this. So it was very new to us. It was very new to me. So when I started my PhD, then I thought, let me find out how many, first of all, scientists in our settings are sort of in my place, don't know much, or even if they would know a little bit, what could be the concerns, how can we express our voices on this? So we started to explore just the perceptions about GM mosquitoes in the context of other alternative vector control technologies. And then from just the work in Tanzania, we found out that yes, the knowledge was low, but there were also a lot of concerns. The stakeholders had a lot of concerns that they wanted to voice. And so that's sort of where we started, voicing our stakeholders' opinions and perceptions. And then with support from FNIH, we're able to expand this to other countries across sub-Saharan Africa. So that's where it started.
Yeah, great. Thanks so much, Lena. Yeah, I guess I'm also interested to hear just what you personally enjoy about this kind of research of understanding, perspectives and opinions.
Many things. I like that I'm always learning about different perspectives. I don't think there is a time you speak with one group and you don't learn something new. When we spoke with the community members, what we would explain a little bit about this. So this was from when I was doing my PhD. Soon as we explained it, immediately they say, "Oh, that's just like what we do. We already sort of modify our pigs and chickens and our maize so that it has some characteristics that we want." So the fact that their communities, who many of whom are even illiterate, were able to relate to this was very fascinating to me. When we speak with other stakeholder groups, the journalists, they liken aspects of these technologies to their lived experiences, and that is always fascinating to me. And then also the fact that you're also explaining something that is so new to people yet relatable. So whenever we explain it and you see the fascination on people's faces, or even the concerns, or learning new concerns, new ways that this could work in our settings. So I like that I learn a lot, and I like that I sort of, even in my investigations, I get to teach something to people. Yeah.
Yeah, wonderful. Thanks so much for sharing that.
Yeah.
Okay, yeah. So Fredros, this study focused on the perspectives of professionals and leaders across Africa with relationships to malaria control or biocontrol. So why did you choose those stakeholder groups for this study, and how did you recruit participants?
Yeah, that's an important question, Michael. So we would have wished to speak to everybody, and we hope that we will continue to speak to people across the continent. As researchers, we are always looking for something, transformative, something that can really change the game, and we see that, gene drives could do that, but we can't move without talking to people. So we would wish to ask people. Now, the question is, whom do we ask? And to begin with, we then said, okay, we can't ask everybody, but we could ask a representative group of stakeholders to begin with, and the others we can ask later as well. And so we started really by looking for stakeholder groups that have either direct or indirect relationship with public health, with malaria control. We wanted to talk to people from the national malaria control programs. We also wanted to talk to researchers within the countries. We wanted to talk to people from academic institutions and research institutions. We wanted to talk to people from ministries of agriculture and ministries of environment, especially because the regulations built in those ministries often influence malaria control. So, for example, in many African countries, insecticides or pesticide control are really regulated by the ministries of agriculture, even though they are very much public health commodities. And genetically modified crops have been used in some African countries, and so they have some experiences with such regulations. So we wanted to talk to people from those ministries of agriculture and ministries of public health. We also wanted to talk to the media. I mean, a lot of information sharing is done really by either the print media or oral media, or also social media. So we wanted to reach out to those people as well as the civil society. We have, for many new technologies, often you have groups that either are campaigning as advocates of the technology or against the technology, and both sides usually have very good reasons for doing that. And so we wanted to reach out to them to ask what their opinions are, what are their concerns are, if they had any concerns, or what suggestions did they have, if they, for example, liked the technology but wanted certain things incorporated in it, or they wanted the work to be done in a certain way. So in the beginning, we wanted to reach those many people, but we couldn't reach everybody. So in the end, we ended up working with about 20 countries. We worked in 20 countries across Africa, plus 5 island nations, so actually 25 countries. But then there were additional people who came in. So by the total final tally, I think we actually reached people in 27 African nations, which is fairly good to begin with. But we hope that we can speak to more people in the end later. Yeah, back to you, Mike.
Yeah, well, thanks. And I know you send a lot of emails. I don't know if you know how many emails you even sent to recruit people, but it would be great to hear about that and how many total participants you ended up having.
Yeah, that's an interesting point. I mean, when we started, we had the option to, either just send out a random survey and wait and see. But we were working with myself, my colleague Lena, Dr. Lena Finda, who is with me here, and 2 other fantastic colleagues. One of them is Dr. Elijah Juma, who actually was supporting us from the PAMCA office in Nairobi. And then we had support also from a colleague of ours called Roshin Tawanji from Malawi. I believe they're probably on the call as well. And in the beginning, we said, maybe we should just send out a long list of emails and see who comes. But then we decided that no, the best thing is really to build relationships. The best thing is to be as personalized as possible. So I made a decision at the time that, I was going to send an email to every single, person we had identified. And in the beginning, we had identified like 360 or so. So this is like the longest series of personal emails I've written. And I sent out a lot of emails to them. And we asked these guys to help us identify people from their own countries. So this, of course, was during the COVID time, so there was no travel. But my colleagues and I were reaching out as much as we could. In the end, we couldn't find everybody we wanted, but we contacted 367 people to begin with. We sent everybody who said yes, we sent a baseline survey for them. This was about just under 200 of them received this and responded. And then after that, we can discuss this later, but after this, we also decided to organize a subset of these people into focus group discussions, some of which we did virtually. The ones in Tanzania we did in person. And my colleague Lina Fenda ran the show there, and we ended up with about 18 focus group discussions or in-depth discussions of varied sizes. So it was, you could say, a fairly substantive qualitative study across the continent. But I mean, we're talking about a continent of 1.2 billion people. So this is still probably not representative, but I think in terms of opinions and perspectives and suggestions, it was reasonable to start there. Back to you.
Yeah, thanks. Absolutely. A really, really impressive effort in terms of outreach and reaching people across different countries, across different regions, across different professional experiences. So I think, informs the results we're going to talk about in a little bit. So yeah, Lina, it would be great if you could describe a little bit more about how you engage these participants, what methods you use to collect their perspectives, what you were working with when you were engaging them.
Yes, Mike, as Fredro said, for anyone who said yes, and this sometimes would be after 5 or 6 back and forth conversations asking for more information. So anyone who said yes, they would be willing to participate. We sent out a survey. So this was a survey with quantitative, with questions about their perceptions of the malaria situation in their countries and what technologies are there, and then leading towards their perceptions about gene drives for malaria control and their level of support just at that baseline level. So we sent out the survey, and then after we got findings from the survey, they sort of informed us about what could be maybe some of major concerns or perceived benefits about the technology. So after that, we grouped people into stakeholder groups. So we had the scientists, regulators, policymakers, mostly from the ministries of health, as well as media personnel. So we grouped them into those particular groups. So in one discussion session, we would have scientists from as many countries as we had discussing perceptions or their inputs about the gene drive technologies. And how we conducted the discussions, we had very simple PowerPoint slides that helped us guide the discussions. And in terms of discussing gene drives, we started with GM, just genetic modification of mosquitoes in general, and then we went specifically to gene drives. Although even when we spoke about GM, a majority of the discussions normally would just go straight to gene drives. But we started with those, and since this technology was very new to a lot of our stakeholders, we provided a very brief description of what the technology is, what it is, how it works, what approaches there are. We made sure to put aside our own perceptions or our own opinions about it, and we will let people form their own opinions. So this helped the discussions to be more informed, and it generated a lot of questions. And often when we were in the group setting, we would put those questions back to the groups to discuss. So that's what we had. We don't call these focus group discussions per se, because at times we had groups of 10 people, and then at times we had 3 people, and then sometimes we had just one person. But we never stopped our discussions. We took every opportunity we got. If it was one person, then we would make it in-depth interview. If it was 3 people or 10 people, so we never stopped because we had maybe just one person. We took advantage of every situation we had. And then in case of Tanzania, since at least I'm based here in Tanzania, we conducted our discussions in person, and we got to have more stakeholders, because if we had a session with policymakers, we would have 8 or 10 policymakers all in one group. We just lacked the diversity of voices from different countries. In this case, it was just from Tanzania, but we had more participants, and the discussions were much more animated and more sort of lively than, but we'll discuss about that later. Yes, so that's how we did it.
Great, thanks, Lena. Yeah, and of course, looking forward to talking later about some of the future directions that this kind of research might take once, hopefully some of the restrictions on in-person gatherings that have been the case over the last couple of years are no longer as prevalent. Uh, yeah, so of course, we've been talking about the work that went into conducting this study, and I'm sure everyone is really excited to hear more about the main results. So maybe, Lena, you can start with talking about some of the main findings that you've had, and then obviously afterwards, Fredros, please also jump in with your thoughts as well. Lena, I think you're muted.
Thanks. The main findings, I will say, the one that surprised us the most was the low knowledge about how gene drives work. The awareness for gene drives was high, but the knowledge of how it actually works in malaria control was low. And that really surprised us because a majority of our participants were scientists, not necessarily working in malaria control, but scientists just the same. So we thought this is probably we had some of the most educated groups in the continent, and that was definitely one of the gaps that we thought, yes, of course we can respond to this easily. So that was one, and then their perceptions about how gene drives could work. So although the knowledge was low, one other thing we found out was that support was high. There were recommendations about how this could work. Maybe they could change what vectors to focus on, or how to think more about how to actually move the technology from lab to the field phases. There were a lot of recommendations in that case. But even with those concerns or recommendations, there was no lack of support, I should say. So it was very few percentage of people that say maybe they wouldn't support it, but a vast majority of people we spoke to, this is based on the survey, supported this technology, or at least more research into it for the benefits of malaria control in our settings. Fredros, do you want to add more findings?
Yeah. A number of things, and I mean, we are still very much in the middle of finalizing of analyzing this data, but very generally, as my colleague Lena has mentioned, you ask people about genetically modified mosquitoes, and a lot of people have heard about this. A lot of people believe that they know about it. What is surprising, as Lena said, was then when we start to probe a little bit about how do these technologies work, then you realize very quickly that people are talking about something else. And this is true even among professionals. It is true. There are actually people who constantly told us that they know that gene drives are already in Africa, which is not the case. Constantly people who told us that they know gene drives are already in their countries. But this was not the true. So not true. So there is a very high level of awareness generally about the technology, but there is very little technical knowledge about how it works and what exactly this technology is. What was also clear from our conversations with people was that there's no clear distinction between gene drive modified mosquitoes and the other genetic technologies. So that was that. But what was also nice was very generally people perceive this as a technology with potential, and so there's actually a lot of appreciation for a new technology. People see this as something that will address specific gaps. People see this as something that could accelerate disease control. And some of the reasons they say this because they believe it would be a much easier approach than some of the things that are currently being used. There is a feeling that you need to release these mosquitoes once and you don't have to do it again, or even if you have to do it again, that it's not as much work as is required for things such as spraying houses or distributing nets. So people relate this to that. My colleague Lina was mentioning earlier that there are times when you're talking to people and they immediately think about crossbreeding of cattle or crossbreeding crops, and you know that is their lived reality, and it's okay that they are starting from there. We just have to explain that gene drive is a little bit different. It will spread differently, but overall there's that thinking. I think the only other thing I want to mention is we did speak to people a little bit about the different forms of gene drive, either those that can reduce mosquito vector populations and also those that don't reduce vector populations but just modify those populations so that they are no longer transmitting disease. And there you also see a very clear difference. There seems to be a preference for population suppression, and people easily talking about, hey, in the past the things we have done have really been meant to kill mosquitoes, and they kind of are accepting of that. But there are also people who don't like the idea of targeting mosquitoes for elimination, so there's kind of room for the modification as well. But in general, that is that. So other than the positive news, I mean, part of the reason that we went out there was also to just document any other concerns that people might have, and there were a number of concerns, and one of these, just people are concerned about the state of the current knowledge. um, um, what will Do we even have people in the countries who have knowledge, adequate know-how about the technology to manage it? And this is a legitimate concern, I think, that needs to be addressed, either by building capacity or stuff like that. And there are also cases where genetically modified mosquitoes have been very controversial, and people relate to those, and there are concerns about safety that were arising every time we had these conversations. But generally, those are the main things that we find: a lot of acceptance, a lot of need for good information about the technologies, but also a few concerns that would need to be addressed before this technology can be trialed in Africa, in the field, and also before this technology can eventually be deployed if the policymakers in those countries choose to deploy it. Back to you.
Great. Yeah. Thank you, Lina and Fredris, for sharing those perspectives on what your findings are. Well, I know a lot of people will be interested in learning more about this and really digging into the to the rich depth of insights that you gathered, through the survey and all of these group discussions. Lina, can you talk a little bit about where people will eventually be able to learn more about this?
Yes, we definitely are going to publish these findings. But also, I think, Mike, would you say in your website and Ifakara Health Institute's Twitter pages, and yes, and then we also definitely plan, we did promise at least the stakeholders in Tanzania that we would regroup and present what their concerns are, and some of which if we have answers for, or some of which how they can be addressed. So we do plan to do that for the Tanzanian stakeholders. For the rest, definitely watch out for, I think you probably would have more answers, Mike. But yes, the IHI Twitter page, Gene Convene, and definitely for publications to come.
Great, thanks. Yes, absolutely. We at Gene Convene are really excited and grateful for the work that you and your colleagues have done, and we'll definitely look forward to ensuring everybody has the opportunity to benefit from those insights. Okay, well, before we wrap up, maybe just one more question for both of you about what other research directions you're excited about. So maybe we'll start with you, Lina, and then give you the last word, Fredris.
One thing that we wanted to do is definitely look into what we've learned about this, like what are the major gaps that we as the researchers in Africa can sort of start responding to. So one of the major gaps were definitely the minimal or inadequate participation in these technologies by African stakeholders. So we want to try and bridge that gap, first of all, by improving the knowledge or the education about these technologies amongst our stakeholders, and how also knowledge of how it fits within our different contexts, but also get more voices out about voices of African stakeholders out there about how these technologies fit. And in this initial work, we were able to get just the collective work, but since we had very few participants from each country, it's hard to say, for example,
Oh, Lena, we lost your audio for a second there. After you commented that you had people from a wide representative people from many different places, but still only so many of them could participate. Still having a little trouble hearing. So maybe Fredris we'll get your perspectives, and then hopefully we'll be able to reconnect Lena and she can continue.
Yeah, can you confirm you can hear me?
Yes.
Okay, sorry that it's unfortunate we lost Lena temporarily, but hopefully she can rejoin. So yeah, Lena was mentioning the need to improve participation. And actually, this is something that is already being demonstrated very well by our colleagues working on Target Malaria, where they have this program of co-development, where a lot of African partners are already involved in that. And I think this is something that can be expanded. So a quick shout out to them. I think that is something that we can derive on. We see a lot of desire for know-how about the technology, but also it's very limited at the moment. So countries just need really to improve capabilities locally for human resources and to encourage those people to participate in the gene drive space. This way, then you are able to advise your own governments, and they have to make a decision whether or not they like the technology or they would like to adopt the technology. So that is one thing. The other thing really is that from the regulatory perspective, our regulators would need to take the perspective of facilitating the introduction or safe deployment of new technologies. And at the moment, for good reasons, the regulatory systems are built to be very precautionary, and that's understandable. But I think that one of the things that was actually coming up during our research was that it's not just the lack of knowledge about gene drives, but also a very general lack of knowledge about malaria situation in the countries. So it would be nice if the stakeholders within their own countries have a good understanding of what the malaria situation is, because then you have potential benefits of a technology such as this, and you can compare that to potential risks and make a risk benefit analysis of some sort. So we're looking at that, and we are hoping that in a future version of a program like this, we would have an expanded reach to many other stakeholders as well, maybe religious leaders, school teachers, for example. We would love to continue to monitor these opinions and see how they change, especially as more and more groups in Africa start to get involved with gene drives or other genetically modified mosquitoes. And so I think we just keep at it. I just want to check if my colleague Lena is back online. Lena, are you back online? It doesn't sound like she can hear us.
Lena, do you want to try one more time? Okay. Well, I know that you can hear us, but unfortunately, we cannot hear her. I'm so sorry, Lena, that we didn't get to hear the end of your perspectives about what you're looking forward to next. But as we discussed before, we hope to continue to have opportunities to talk about this research, and including the future directions that you and your colleagues take it in. So we'll absolutely look forward to that. I guess before wrapping up, I'll just give another quick plug, building on some of what Lena and Fredros have said. One of the goals of the Gene Convene Global Collaborative is to provide a resource to share information about gene drives and other genetic biocontrol approaches for public health and also broader applications. And so, please feel free to check out our website, our virtual institute, the other resources that we try to collect and make available for anyone and everyone who's interested in learning more. So then with that, again, thank you so much, Lena and Fredros, for all of the fantastic work you and your team have done, and for joining me today to share it with everyone who's listening. Anyone who is listening, you can learn more about Ifakara Health Institute and Gene Convene on our web pages and social channels. Both organizations run online events, including masterclasses and webinars. So if you're interested in this topic, please check those out. We hope to see you there. And again, thank you everyone so much for listening to this conversation with Drs. Lena Finda and Fredros Akumu. Take care and goodbye.
Yeah. Thank you very, very much. Thank you very much, everyone. And we look forward to seeing you guys again. All right. I just unmuted my Zoom in case you guys are still there.